I'm gonna read some comments for you. Feel free to bleep or whatever. How the did you get on here? I never go to Jew doctors. I consider them incompetent.
You're concerned about losing those financial kickbacks, aren't you?
I've been told that I'm a baby killer. I should lose my license for supporting vaccination.
God, if you were one of my doctors, I would sue your ass.
Facebook tends to be a trove of nice, loving people.
Doc creating customers for life. That kind of emoji.
Today we're talking about what causes autism. And for those of you who are new around here, we're only using good evidence-based science, no internet crap.
Holy cow, folks, I cannot tell you how wrong RFK Jr. is about vaccines and food allergies.
All right, let's talk about some wild claims floating around the internet because misinformation spreads faster than a toddler with a Sharpie on your white wall.
I started out mostly in just kind of well-child good advice, but it quickly became very apparent that there was a niche around vaccine myth debunking that not many creators were willing to step in because it becomes so toxic so quickly.
I would have mothers especially come into my office saying that they saw something online that either made them have more anxiety or made them feel more confused.
Since the beginning of 2025, I've spent a lot of time correcting a lot of the misinformation that's been coming out of this administration that's related to issues like vaccines and autism or acetaminophen use during pregnancy.
So taking Tylenol is not good.
Some 40 to 70% of mothers who have children with autism believe that their child was injured by a vaccine. The more fluoride in your water, the lower your IQ is going to be.
Fluoride impacts IQ. Vaccines cause autism. That's coming out a lot. RFK Jr. says that he can look at kids and diagnose mitochondrial diseases by looking at their faces.
The appointment of RFK Jr. is probably the biggest health threat to our children in decades.
Holy cow, folks, I cannot begin to tell you how angry I am right now because the CDC is dead as we know it.
The problem here is that this isn't from a random creator. This is from an official government website that's designed to protect our public health, and they're not.
The President and Secretary Kennedy are committed to restoring trust and transparency and credibility to the CDC.
It is scary because you're now seeing pediatricians and health communicators saying one thing, and you're seeing the government say something else, and it becomes, who do I trust?
For a while now, especially since the beginning of the pandemic, healthcare workers have been demonized. We are being told that we are the problem.
When my daughter was born, I had really bad postpartum anxiety. Having those mental health concerns myself, I think has really opened up my understanding of how vulnerable mothers are, especially in that postpartum period. And so when they go online and they see a fear-mongering post, those messages hit hard. And that is where all that misinformation and all that doubt can seep in.
So when your kid was sick, do you choose Tylenol? Do you choose ibuprofen? Do you choose something else? I don't need to teach the people who already agree with me. I'm there for that really 75% of people right in the middle that are looking for truth. And so you have to be really careful with that group because so often you're responding out of reflex to this toxic troll, and then you'll accidentally take an honest question and have the urge to have a snarky response. And that's where I really have to make sure that my responses are legitimate, honest, but also empathetic.
So there's this idea floating around from the anti-vax handbook that pediatricians recommend vaccines for the money because apparently we're all about bonuses, foot traffic, metrics, and funding our yachts.
So people say that I'm a paid pharma shill all the time.
You know, the whole pharma shill situation has been very hard to swallow as a pediatrician, given that we are the lowest paid specialty.
The premiums and the costs of healthcare have risen a lot, and we are in a for-profit, multi-billion-dollar health insurance industry.
But because we work in this system, it's assumed that we are complicit in this money-making scheme of American healthcare.
The hard reality is, I think for the next few years, we are going to continue to see an attack on public health.
If I didn't have to do vaccines 50% of the time, if I didn't have to disprove our CDC, our HHS secretary, our president, I could go back to more parenting advice.
So we can't sit by and do nothing at this point when we are credible voices to speak out and try to change the system.
The modern medical system has to do better in explaining the why and not shutting a family down when they have a thought that may be different than theirs, so that we don't push them away into the hands of misinformation and something that can be far more harmful.
I hope we learned some good things today. But what's that big old takeaway? Be careful who you trust on the internet. Grifters, influencers, and politics are not the people that you should pick to help make decisions for your little kiddos. See, childhood mortality, it's very low, you see. Saving lives of you and me, thanks to those safe and effective